Welcome to our program. We are dealing with simple home remedies. Beautiful simple home remedies. And before we start, I'm just going to share with you a disclaimer. Just realise when you try anyone, and when I have these classes, you'll always find people who go home and they want to try them around. And look, almost you can't do any harm to yourself doing these type of remedies, but you still need to be careful and take your own responsibility for it. Now, God's remedies are what I'm going to teach you about. They are simple. They've been used for thousands and thousands of years, but the knowledge is almost lost. But they take time and effort. Sometimes they work fast, sometimes slower, but they do not debilitate the system. It's not like you're going to go home and you're taking antibiotics and then you have to worry about, oh no, I've got to get rid of the residue of these drugs in my system. There's no such things. Your body will love them. Now, I want you to see something here. Actually, I should have highlighted it, but if you take, it's really an acronym. God's remedies are simple, they are available, they are affordable, or they're free. But we need faith. We have to believe God's remedies can heal, and we pray for the healing, and they're easy. Now, if you go through that, that's an acronym. SAAFE. Safe. Simple, available, affordable, or free, and we need faith, and we're easy. Now, I want to tell you before I start, I believe in these totally, but when I do them on people, I always pray and I say, God, will you please bless this? Because you know something, He is the one that heals them. And I want to just preface that before I do all of these, because God is the master of healing. He's the one who's told us that we need to use simple natural remedies. You follow through in the Bible. He used clay. They used figs. Hezekiah used figs. So we can see that this is something that He wants us to utilise. Now, first of all, I'm going to talk to you about poulticing. Now, I bet there's some people who are here who've never heard of poulticing before. Any hands? Yes? Poulticing. Some people have never heard of poulticing. What is it? It's an application of vegetable, plant or herb. It can even be fruit. It could be anything, but it's like a vegetable base. But it's or a vegetation base, maybe I could say that. And it's directly applied onto an affected area of the body. An exchange takes place, toxins are pulled out through the skin. So what we're going to do is I'm going to show you, first of all, how to do a potato poultice. And I'm going to show you how you put it on your skin, and all of these poultices will work the same. An exchange takes place. You put a poultice on your skin, and what's in there, if there's inflammation or if there's an infection in your arm or your leg or wherever, it will be pulled out through the skin and it will go into the poultice. Poultices can draw out infection, fluid, or embedded articles from the skin. They can break up congestion. They can release symptoms or ailments. They can soothe the inflamed areas such as joints and muscle pain, irritating coughs or contusions. So you can use them for many different things. Now, how do you make them? Well, I'm going to show you how to make it, but I've just got just one slide here. But you just use a powdered herb and you make it to like a paste or a thick paste with water, herbal tea or oil. Or you can use grated or well pulverised herbs, plants or vegetables. But there's no such rule that says you've got to do it exactly as I'm telling you either. Like I've heard people, they will use a potato and they will just, I'm going to show you how to grate it up in a moment. But some people, you can put it on if you want to just cut it as a slice. There's no such rule that says it has to be done my way. But I'm going to tell you why it's easier to do it, because I've had experience with it. And so I'll share you with that in a moment. Okay, now first of all, I'm going to talk to you about the humble old potato. As I said, it could be free if you're growing them. And I want to just preface this because I always get this asked. Are organic vegetables best? Obviously they are, but can I tell you, I have often just bought shop-bought vegetables like potatoes or cabbage or whatever I'm going to show you as we're going through this series. They work as well. Now, so you use what you've got. Don't think you have to get organic. I've found that organic does work better, but you don't need it. There is still nutrition in this humble old potato. Now, you can do a potato by drinking it and doing an internal detox. You can do your liver detox, indigestion, heartburn, and you can do it for stomach ulcers, you can do it vomiting, for acid stomach, diarrhea, and for heavy metals. Did you know that heavy metals will actually come out with your potato juice? But can I tell you what? Has anybody drank potato juice? It's not that nice. It is not nice at all. You will need to have it mixed in with some other juices. It's pretty terrible. But I tell you what, it tastes, as I said, tastes, but it does you well, right? But I'm not talking about that right now. I'm going to talk to you about potato used as a poultice. I'll just read the list out at first. You can use it for splinters, prickles, swelling, burns. I'll just stop here and I'll just tell you some of the stories as I'm going through. Splinters or prickles, that's really an obvious one. But I know a friend of mine, she had a son who ran up a great big splinter up his toe. And the splinter was probably about 2 centimetres long. And she used a potato poultice to pull that splinter out. And she never took her son to the doctor. She was living right out in the middle of nowhere, and it was just inconvenient to go to the doctor, and she knew what to do, so she used the potato. And you can use it for splinters, prickles, you can use it for swelling, you could use it for burns. Incredibly great for burns. I've even heard of a potato, and there is one man, he went into, he was looking for, this happened, I saw this as a report from somebody who was giving it online. And he went into a little room looking for something in there, and couldn't find the power point, but there was a gas leak in it, and he went in and he lit a match. And there was an explosion, and all his face was burnt. And the people there knew exactly what to do. They went and they got the potato. They just caked potato. He lay down. They caked grated potato all over his face and all over his neck area where he got burnt, left just little holes for his nose. They left it on. First of all, you left it on probably about 5 minutes. Then they scraped it off. Then they put fresh stuff and put it on for 10 minutes. They scraped it off. Next time they put it on for 15 minutes. Each time it just added a little bit more. What happened, it was so soothing. And after about probably 2 days, he was pretty right again. Look, it's amazing what you can do with something like this. I have heard this time and time and time again. They do work. Okay? You can use it from abscesses and boils, any deep drawing, sprains and bruises. Now, I've heard many people, they've had sprained ankles. And you make it. Now, obviously, I'm going to show you how to make it in a small scale, but you just make a larger poultice if you're going to put it over your ankle. Or I've even heard people, they've just grated their potato and they put their whole foot in it. Lumps and tumours, that's another one. I remember I was working and helping down at a health retreat, and they had a patient. There was a young man who came in and he had testicular cancer, and they wanted to operate then and there. And he said to the doctor, no, I want a couple of weeks. I've got to think about this. So he went to the health retreat, and there they did a series of poultices on his, just behind his scrotum in that area. And one of the poultices they did was potato, because I was there, I was watching it, and I was watching them prepare all the potatoes. And the other one, which I will share with you later, was a castor oil poultice, which I'll talk about in a little while. So that man, 2 weeks later, he noticed the lumps were growing smaller, so he had confidence, and he never had the operation, and he actually was totally healed, because I did follow up and I asked what happened to him, and he was totally healed of that testicular cancer. I've heard it many times, you can do it, but sometimes you have to work different poultices in. It's not just one. Okay, you have to know, and look, you do need to know what you're doing, but you get better as you practice it. Ulcers, arthritis, inflamed eyes, ingrown toenails, hemorrhoids. You cut a little bit. If you've got a hemorrhoid, there's a few. Nothing can be worse than a hemorrhoid if you've ever suffered from it. Cut a little piece of potato and put it. You can insert it as a suppository, and it will ease the pain. Castor oil is another one, which I'll talk about later, for hemorrhoids. But I'll just tell you a story about a friend of mine. She had an elderly neighbour who had a leg ulcer. And this leg ulcer was so inflamed that the doctor said that she had to get a leg amputated. So my friend went over to her, and this elderly lady was visiting her daughter, who was a neighbour of my friend. So my friend rang me up and said, what do I do? And I said, get into the potato poultices. And so she does. It was only a smallish ulcer, but she did quite a large potato poultice on the leg. Now, the next morning after she put it on, she said she went back and she said she nearly got sick. When you put this on, you will find it smells so bad. I've heard different people. There was another report. One woman, she was pulling cancers out of her breast, and the person who was doing it said, look, she smelled like a dead animal. Honestly, it smelt like a dead animal in the room. It was so offensive. Now remember that is to be expected. You're pulling out toxins, so you pull them out through the skin. Anyhow, this lady, the story of it, she did potato poultices, then she did some cabbage, which we'll talk about later, cabbage, and she did some other ones, and she did a whole plus we put her on I told her get her onto a blood cleansing herb, because she needs to get her blood cleansed. See, if you've got a leg ulcer that won't heal, it's because your body is toxic and it's pushing the toxins out through an opening. Those toxins should be going out through our bowels, through our breathing, through our kidneys, but they're not. So your body's just using the next best thing and pushing it out through that ulcer. So let me get to you and show you how to do a potato poultice. So what I do is you can use any cloth. You don't have to use a chucks. Now, I usually use chucks because you can throw them away. So I've got a chucks here, just an ordinary. Now, because the holes are quite porous, so you need something with porous holes. Now, if you don't have a chucks, you can use just a cloth, but you'd need to have a cloth that's quite porous. Now, what I'm going to do is I've just got a grater. This is the grater that I've got. And it's just like the apple-sized grater, and I'm just going to grate it in the middle of my chucks. I don't know if you can see it, but I'm just going to grate. Now, all I've just done is I've washed it. I haven't even bothered peeling it. Oh, that's nearly enough. Now, what I'm going to do here, I've got a little pile of grated potato there. So what I'm going to do is I'm going to fold the first side over. Each side I'm going to fold over on the top. So I'm making a little parcel. Now, believe me, I've tried this without putting it in a parcel. And I tell you what, it is terrible because it just drops everywhere. That's why I put it in a parcel. Okay? You don't have to. You could put it straight on the person if you wanted to. There's no rule. Now, that side there that's only got the one thickness is what I'm going to do, and I'm going to put it on somebody. And I'll like somebody come out and I'll put it on an arm. Okay, Sylvia. Maybe I'll put it on your arm so people can see. Otherwise, but you can put it anywhere on your body. You can put it on your shoulder, wherever you've got inflammation or anywhere tender you want to pull out something. But I just put it on like this. And then I use Glad Wrap. Now, you can use Glad Wrap, just your normal Glad Wrap, but I've got a little Glad Wrap which I came across, and I bought this at Aldi. And it was a tape for, I think it's a hardware tape or something, but it's just ideal. And it's smaller. It's got a little handle to it, but you don't have to have that. I've used Glad Wrap for years. And you just wrap it around like this. Or if you don't want to use Glad Wrap, just put a bandage over it. It's fine. Now, the point of this is that will weep. It will get wet, and you need to be careful. If you've got it here like this, that will be fine. If you leave it on, how long do you leave it on? You leave it on, I think, for... What's happened there? I'm not sure what's happened. I'm just trying to get it on the computer. I've just lost it. Okay, I'll leave Ralph sort that one out. Now, you leave it on, but it may... How long do you leave it on for? No, if it's a burn, you need to change it a lot quicker, depending on what you're treating. Okay, if you've got something very infectious or very, very toxic, you need to change it often. But if you haven't, you could leave it on overnight. Now, if I was leaving that on overnight, I generally don't, unless it was like this lady I told you about, the leg ulcer, she left it on overnight. That would weep in bed. And you don't want your sheets all, because it stains your sheets. Can I tell you, potato change stains your sheets? I found out the hard way. Okay. So what I would do, if I wanted to leave that on, I would cover that with a bag, and then I would just use a plastic bag over the top, and I've just got garbage bags. Well, this is the garbage bag that I would use over the leg, a big garbage bag, and I would put it up. Even though it's huge, I would just take a bit of tape, masking tape or something, and just so it's not so huge. And so you can leave that on there like that. So that's what you do for a potato poultice. And you'd be surprised how often just something so simple like that. You've got a knee that's infected and it's swollen. You just put a potato poultice on. I can still remember I went to I had some neighbours, and I was telling this is a young man, he was a footballer, and I was telling him about his football injuries and how he could use poultices on his football injuries. And he said to me, do you think there's anything, you think it'll cause any harm? And I said, you know what, I want you to stop and think. Do you really think that it's going to do any harm just putting a bit of poultice on the outside of your skin? And he thought about it and he thought, that's stupid. I mean, people think that they're going to harm somebody by putting a bit of potato on their skin. Look, you can't do any harm to anyone. So just realise that. The thing that you've got to know, though, is if you're going to do it on a leg or some area and you're leaving it on over a long time, it will drip and it will get wet. And the person, if you're not ready for it, they'll get all flustered. Just remember that. I would do that, and normally you put it on at least for 2 to 4 hours. What's happened to my... No, I can't get it to change. There it is. Needs someone else's hand. Okay, how long do you leave it on? For seriously draining wounds, change every 30 minutes, then every hour, then every 2 hours, then every 4 hours. Do not leave it on longer, as it will be filled with toxins and the skin will reabsorb it. For less acute injuries or wounds, you may leave it on overnight, cover with a plastic bag and secure it, as it will leak. If pus develops, discontinue, exposed to air and sunshine if needed. Now, I've had this. I want you to look at that injury. If you look at it and you say, yes, I can put another one on it, and sometimes you can. But sometimes if you look, it's going to draw out pus, and you look at it and say, don't just do back-to-back poultices. You need to let it air out. You need to get a bit of sunshine, because you can ulcerate it if you just do back-to-back poultices. So just if pus develops, discontinue, exposed to the air and sunshine if needed, and then maybe wait a day and do another one. Okay, now I'm going to talk to you about an onion poultice, or the onion, humble old onion. See, these are things that are readily available. So many people, they are readily available, and they've got access to potatoes and onions. Humble old onion. Now, the first thing I'm going to talk to you about is how I can use it, or actually I'll go through what I've got on the screen first. You can use it cooked. Bronchitis, influenza, asthma, colds, congestion, coughs and earaches. And I'll show you how you use them in a minute. But you use it raw, you use it for sores and tumours, ulcers, calluses, fumes and inhalation. And you use it for asthma on your feet. And you can use it as a cough medicine. Now what I've done here, I'm just sharing you the cough medicine first. What I've done here is I've got chopped up some onion. I've got 3 onions in there. I've chopped it up and I've drizzled about just over a cup, maybe a cup and a quarter of honey on it. And when I use honey, I always use the good honey. It's raw honey. It's never the stuff that you get, just cheaper honey. Now, what that's done is made a juice down the bottom. That's been sitting. I made that this morning. Now, that usually after about 4 or 5 hours, it will develop a juice down the bottom, and that's the juice that you drink. What I do then is I strain it, and you drink that, and it will keep in the fridge for probably a couple of months in the fridge. But it's ideal as a cough medicine, and you can't overdose on it. You just keep taking it, and you take a spoonful of it, and maybe then half an hour later you take another spoon of it. And kids like it. It's quite pleasant to taste. Now, if you would like to, at the end, you can come and taste it if you'd like. I've got some spoons here, and you can have a spoon of it, and you can taste it. So we'll drain it off afterwards. Now, the next one, that's for the first one. Now, the next one I'm going to talk to you about is an earache. Get an onion, whole onion, pop it dry in the oven and cook it. No water in there, nothing. Just sit it. You can sit it on the rack. Pop it in the oven.
Don't peel it?
No, I don't worry about peeling them. Okay, so I'm going to show you. You get it out of the oven and you've got to realise that this will be hot. Just remember it, it's going to be hot. So I'm just going to slice it in half like this. And that's hot, so obviously I'm not going to be holding it with my hand like I'm doing it now. But I get a hand towel or something like that, and I put it, the cut side to the towel, and then I put that on the ear like that. Now the fumes will penetrate down into your ear and it will bring relief. And sometimes if you've got a little baby or a little child, you can actually lay them asleep on it. You can put their head with their ear on it. Obviously, you must be careful that it's not going to burn. Okay? Please be sensible. But you check it, make sure it's not going to burn. But it needs to be warm and it will work, right?
This is for earache.
This is for earache. So you've got one on both ear. And then I can still remember when my granddaughter was little, after I put it on both ears like that, I bandaged her up and she had these huge, she had these huge earmuffs and I put the bandage on and she thought it was wonderful. It's really, the kids love it. Okay, so when I'm going to talk to you about doing the onion poultice, and you can do it on your congestion on your chest. Now, years ago when I first started learning this, I heard about onion poultice on chest. So I thought, I'll make an onion poultice for my chest. And I didn't cook it. And I realised later I should have, because you don't want to put cold onion on a chest when you've got bronchitis or got something wrong with it. Remember, this is an antibiotic poultice. I should have stressed that because the potato poultice was a drawing poultice. This is an antibiotic poultice. So you use it anyway. Now, if you wanted to find this, because it's in the book, page 24, you'll find all this is written out. Antibiotic poultice. Antibiotic poultice penetrates any tissue beneath, and it does. It really penetrates, and it works wonders on your chest. So if you're going to put it on your chest, and there's instructions, if you'll find down there, cough medicine for cad colds and chest congestion. And so what you do is you'll see the instructions are all in your book. And if anyone who's online wanting the book, this is the book. And you just go online. It's on my website. And so you can buy it from there. But it's got all these poultices in there as well. Okay, so what was I talking about? That's right, the chest congestion. So what I do is I roughly chop up an onion, which I'm not going to do that for you here. I roughly chop up an onion, or maybe 2 onions, depending on who I'm doing it for. If it was for a man, you'd want 2 onions. But maybe for a child, you just do 1 onion. And you just chop it up and you pop it in the oven on an oven slide and cook it. Maybe about 20 minutes. Doesn't need to be overcooked. But it'll get a little bit sort of sticky. Let it cool down. And you can either put it in a chucks, or you could put it straight onto the chest, because it is very, very comforting when it goes onto that chest. And so obviously make sure it's not going to burn, but you put it on there. Then you cover it over with maybe a towel or a bit of an old blanket or something like that to keep the heat in. Or what I do is I usually put a hot water bottle over the top of that, and it keeps it warm. Now that will keep it warm for about an hour, 2 hours. If it doesn't, this is one of the few times I would reheat those same onions up and put it on again. So you can use it twice. Normally when you do a poultice, you always throw a poultice away straight away after. But this is probably the one time I would do it because it's an antibiotic poultice and it's not absorbing into the onion. It's the onion's going inside your body. So that's what you're doing there. So I would leave that on. Look, the kids love it on. And, you know, when you have it on, it's very comforting. Very, very comforting on your body. And you'll find that you really enjoy it there. And especially if you've got something like coughs, congestion, colds, or anything like that. Now, the last one I'm going to share with you is the one for asthma. Now, what I would do here, and I'm not going to do all of it, what I'm going to do is I'm just going to slice some up as onion rings. I'll just pretend it's like I've got a small child and I'm just going to put it on their sole. What you do is you put it on the soles of their feet. Now, you cannot believe how, if you put things on the soles of your feet, within minutes, you'll be able to smell it on your breath. You put a garlic poultice on your feet, in minutes you've got garlic breath. Your pores on your bottom, soles of your feet are very, very large and they can pull it up into it. See, how often have you heard about detoxing through your feet?
I've done it through a Japanese.
Yes, that's right. Yeah, that's right. They pull out a lot of toxins. So what I'm going to do is I'm just going to roll. I've just got some sliced onion there, like that on a chucks. What I'm going to do, the same process as I did before, just fold it over. Then I'm going to get my rolling pin and I'm just going to bruise it. Now you can grate this, but I really just don't fancy the idea of grating up my onion because it's just going to I'm just going to cry like mad. When you've got a poultice, the secret is you must be wet, okay? But it can't be dripping, okay? You've got to get that medium right. So what I'm doing there, now if that is got moisture onto the breadboard which I've got it on, now what I would do is I would put that onto soles of someone's feet and then I would do the Glad wrap around there again, like I showed you before. So that's how you help. And you can't believe, you've got a child, you know how they go to bed, they just cough and cough and cough and cough and they can't stop coughing, they're coughing all night. Just go and put a couple of poultices on their soles of their feet. And even you don't have to put, I would tend to put tight socks over the top there to keep them in place, and then they will all of a sudden it just relieves the breathing, just as simple as that. But it's also good for asthma, for people who've got asthma. And I can still remember one class years ago that one woman, she challenged me from the audience. She says, "I'm sorry, look, I'm a nurse. That's most irresponsible of saying that you should put, if somebody's having an asthma attack, they need to go to the doctor." And I said to her, "Look, I grew up when my mother was an asthmatic. I know what it's like to live with somebody who is an asthmatic. If they went to the doctor every single time that she had asthma, she'd be at the doctor every day of the year. She had an asthma attack every day. So I just knew she was very severe, and eventually she died of asthma, having an asthma attack. But I didn't know what I know now. I would have helped her. And that actually spurred me on a lot in my desire for wanting to find things, because I thought, how could I help someone like Mum? But and there are other things you can do for asthma. And this is not the only one, but this is one that you can use because it just stops that congestion, makes them breathe easier. By the way, too, did you know that often asthmatics are just dehydrated? I've got a book at home called Your Body's Many Cries for Water, written by an Iranian doctor who was imprisoned by the Shah of Iran. Of those people who are old enough, remember when the Shah of Iran took over Persia, and kicked out the Shah was kicked out, and I should say that again, the Shah was kicked out and Ayatollah Khomeini came in. Remember that? Okay, those of you probably in the 1970s. Anyhow, this doctor was an educated man, so he was imprisoned in Iran. And would you believe that he had people coming to him and said to him, "Oh, you're a doctor? I've got an ulcer." What did he have? He said, well, go and have a drink of water. Everybody who came to him, he says, go and have a drink of water. And he said, you cannot believe how many people were cured just by having a drink of water. He'd say to somebody who had an ulcer attack, go and have two glasses of water. Somebody who had asthma, go and have some water. And often they are dehydrated because their body, their asthma, is their bronchioles, they don't want to give off that water vapour, they don't want to breathe it out, so their body is restricting their bronchioles to save their life. So many people who have got asthma are dehydrated. And I'm not saying it's the only one, but I tell you what's the first one, and I look back at my mother's life, she hardly drank any water. Hardly drank any water. So many, and people, unless you're drinking about 2 litres of water a day, you would be dehydrated. And most people, if you think you're going to start, it takes about 6 months to rehydrate your body if you're dehydrated. One woman, I heard she was very, very depressed, and she said once she started drinking water, and she said all of a sudden the depression went. Why? Because this is a cause, depression. It's simple, but people don't think of this. How much water are you drinking? You need to make sure, if you're drinking enough water, then there are other causes that you can look into. But, you've got to look at the obvious first. And most people, as I said, are dehydrated. So that is the onion poultice. Okay, here are the ones I said: earache, coughs and croup, chest infections on the feet. Okay, next I'm going to share with you about a garlic poultice. Humble old garlic. Now, that is on page, I've jumped a bit, I'm sorry about that, but page 29. And it's another antibiotic poultice, but this one, you can use it. It's an antiviral, antioxidant, antispasmodic, antibiotic. It expels phlegm, coughs, increases immune system. It's great for thrush, colds and flu, asthma. It's good for warts and good for fungal infections. You can actually peel a clove of garlic and you can use it for vaginal thrush. You peel that clove of garlic and you can, sometimes if you score it, you peel it and you can actually score it around it and you can insert it for vaginal thrush, and it's great. It really works. The only problem is you'll have a garlic breath. I've tried it and I've said, I've had it done, and my husband's come home and I've kissed him and he says, I know what you've done. Okay, so garlic, that is ideal. And it's not the only thing. I've got some more things I can share with you for vaginal thrush. Excellent. But you would, if you're going to do it, you would need to wear a panty liner because it actually draws juices out and it could stain your pants. So just remember that. So that's great for vaginal thrush. You can do this in a similar way that you would do for the onion poultice, but this one is a bit more powerful. And if you put this poultice on your skin, it will blister your skin. Be careful. Now, I actually was watching some guy, he said if you blister your skin, but then if you've got on a swelling, that you can actually prick the blister and you can actually get rid of the fluid in your body that way. But look, I haven't tried that one. So I haven't tried that one, but I know, but you will blister your skin if you put garlic poultice directly. So the secret is to put it and you coat your skin with oil. Do not apply garlic directly on the skin, it will blister. Apply a coating of oil first, then use a cloth between the garlic and your skin. Now, it's the same thing. I'm not going to go through the whole rigmarole of this. It's exactly the same as all the other poultices, although I'll show you. Let me show you. I'll try it on a paper towel this time. See, if you've only got paper towels, you can use paper towel for a poultice too. So and this is excellent for whooping cough for little babies, but do not put it directly on their skin. It will blister. And I know people who've blistered their baby's skin by putting it straight on their skin. So just be careful. I would put a cloth between them and I would put oil. I would just be double careful. But this will cut your whooping cough. This will just like that, ease your whooping cough. Because it goes into the body. It really does. It doesn't take long. So what you do, as I said, you can either slice it or you can put it through your garlic press. Actually, where's my garlic press? Somewhere here. And you can put it on and you could use this using a paper towel like this, and you can fold that over and you can put that on the soles of someone's feet, and that will reduce your coughs. But remember, it will blister, so you've got to be quite careful and not, you don't want to blister someone's skin. I'm going to suggest something to you. Try it on your own body somewhere first. When I first started all these poultices, I tried them on myself. And I realised there was nothing worse than sitting there and having bits of potato dripping all around. And I thought, this is not good, okay? And you realise you've got to think of some other way, because if you're going to help people and you've got to share it with your family, you don't want it dripping everywhere. You don't want bits and pieces falling out, and if you walking around, And some people you can actually, and I've done it, you can actually put it on some tight clothes over the top. Let's say you've got a chest compress on, you can put tight clothes on over the top and you can wear it around. You can do what you have to do. Actually, I forgot something. I want to go back to the potato poultice, something really, and I know that it was and I forgot all about it. Especially good potato is especially good for eyes. It is one of the best things you can put on your eyes. Now, what I suggest when I'm doing it on my eyes, this is potato. I don't know what I've done. I've got cotton wool. Some of these young girls have these cotton wool pads that are the shape, they circle like an eye. But I don't have that because I'm not into that sort of thing. But what I would do is I would grate a potato up and then I'd blot up the juice and I'd put it on my eye, or I'd make tiny little parcels for my eyes if I had to, put one on each eye. Now, if you've got conjunctivitis or an eye infection, this is ideal. All of a sudden, I've had people, I can remember somebody says, they've got this eye infection. I put it on, they could not believe. A couple of hours later, they said, that feels good. And can I tell you that most people have got, their tear ducts, everything is blocked in their eyes. Once you get in there, this is excellent for clearing out congestion in your eyes. Pulls it out, it's great. So one for each eye, or you do one at a time and you just put a bandage around there and you walk around there with one eye and hoping nobody comes to your door. and then the other eye. So you just make do. You just try to fix it in place the best you can. Okay, so that's garlic. And you'll see it in the book there. Oh, there's another way you can actually make garlic, and the recipe is in the book. When you cook the garlic, and that's in the book, when you cook the garlic gently with coconut oil, and then you strain it afterwards, that oil can be rubbed on, like for instance, any cancerous lumps or anything like that, and it's garlic oil. You can actually put this your sliced garlic in olive oil, soaking it, and then you tip it out and you use those drops for ear. Excellent for ear drops. See, remember, it's a similar poultice as onion. I said to you, you can use onion for your ears, or you can use garlic for your ears too. But I would use garlic in the oil. I wouldn't put pure garlic into my ear, okay, because it's going to blister. You don't want a blister in your ear. So you just got to think, and you realize. But I've done that. I've had garlic oil, maybe 3 or 4 cloves, and you just steep it in a little, chop it up, steep it in a little bit of olive oil in a little jar, drain it off, and there's your eardrops. But this one you can use, as I said, the garlic oil. You cook it gently, and what happens is then it becomes it's absorbed. That garlic that allicin is taken right inside of your body, and it becomes like a great big transdermal patch. And you see, normally if you take garlic, you've got to take it in through your mouth and through your digestive system. Well, this bypasses it and goes straight into your body via your lymphatics. Excellent for breaking down tumours and lumps and bumps. And a lot of women have fibrocystic breast lumps too. And you can break them down with this sort of thing. Garlic oil. Now the next one I'm going to share with you is a castor oil, which is page... I haven't got mine at the page 26. Now, castor oil is something that you can't get for easily in shops. You used to be able to buy it in the supermarkets, but you can't buy it in the supermarkets anymore. You've got to go into some of the chemist shops and you have to get it. But I've actually bought quite a bit of castor oil. And there's many times I help people because they don't have any. So I say, well, here's some castor oil. You can have some. Just go on here. Castor oil. Now, I'm talking about externally. I'm not talking about it, even though some of you may have stories, horror stories when you were a child. Your mother fed you with castor oil and all that sort of thing. Well, so be it. But I'm talking about externally here. It is great for constipation. Now, how do you use castor oil or constipation if you're not breaking it up internally? Well, I'm going to show you how to make a poultice in a minute, and you put your poultice over your abdomen. Okay, and it will break up. Castor oil will penetrate deep. It will penetrate right into the... it'll break up lumps and tumours and cysts, and it passes in quite deep into your body. So if you've got a cyst, you want to break a cyst up, you can just rub castor oil on. You can use castor oil poultices. You can use it for stomach cancer. Now, I tell you, this is a story I have from my cousin who was in the last stages of stomach cancer, and his wife, he tried everything, I would tell him. He tried the potato poultices. He tried all sorts of things. He and his wife were real guinea pigs for me. They'd come in and they'd said to me, I said, what they did? Well, this particular one, had stomach cancers, last stage of stomach cancer. And he said he was in agony. But every night his wife would faithfully put a poultice over his stomach area, and he said that would ease the pain. And he got to the stage where he said one night they'd been out, and he said, "Oh, don't worry about it tonight. I'll go." But he was laying in bed, and he's had so much pain. He said to his wife, he says, "Look, I'm sorry. Do you mind? I really need it." And he said that it just relieved the pain so much. It is a great pain relief, castor oil, when you put it on externally. Bone spurs. How do you put it for bone spurs? Well, what I do is you put a little... When I use this and I tell people, what I just do is I say, pour it, don't dip your finger in there. And it's temptation for some people to do that. Pour a little bit out on the palm of your hand and just take this and just rub it around your bone spur. Massage it in like that. And then you will find, and you might have to work at it for quite a while. It just won't come off with one time. Now, generally, some people it may take 2 weeks to 2 months to get rid of a bone spur. But it will take time, okay? So just persevere. Generally they say, how long have you had it for? They say as long as you've had it for, it can be as long as you get rid of it. Okay? So, calcium deposits, the same. I can remember one class, one lady, she had a ganglion on her wrist. She said, and she went home, she did some castor oil, and she said, came back 2 weeks later, she said, guess what? It's gone. She was so thrilled. Just a simple thing like that. So I would rub it on, then I would even do a poultice on over the top of that, but I'll talk about that in a minute. For moles, you can put castor oil on the moles, but I'm going to tell you another one while I think of it, because I forget if I don't tell you now. This is another way, especially if you've got moles on your face, and these are generally the black moles I'm talking about. You want to get rid of them. In the morning, when you wake up, the first thing before you've even cleaned your teeth, you've had a drink, you've got that nighttime, that saliva in your mouth, you put it on your tip of your, and then you put it on your mole. Put your own spit on your mole. And guess what? Can take probably up to a year, but it'll fade it away completely. I had somebody, she heard this, one of my class members, she heard this, and she said, I'm going to do that, but I'm going to do it a lot more. She said in the middle of the night, she'd wake up in the middle of the night, she'd go like this. She had one just on her chest there. In the middle of the night, she'd do this. Every time she thought about it, she put it on her there. And she was 3 months before she got, and it went away. And I tell you what, how many people have got an unsightly mole on the middle of their face and they just would love to get rid of it? And this is a simple way. So that's just own saliva. So just remember that. Now back to the castor oil. Moles, warts, skin cancers. Okay, so you can use those. These are all. Now, there's other things I've got for skin cancer, which is a burning off one. That's in the herb talk. But this one is another one that you can use. Now, this for hemorrhoids is ideal. Now, this is probably the most effective one from a hemorrhoid. What you do is you get a cotton ball. I've got them somewhere here and I can't see them for looking. Okay, but you get a little bit of cotton wool or cotton ball and you drench it in castor oil and you put it on a plate or something in your freezer. You deep freeze it. And then you bring it out of the freezer and you put it on the hemorrhoid and you allow the buttocks to to hold it and keep it in place, and it will. It'll just stay in place. And that coldness and that castor oil will relieve that hemorrhoid, and you can't believe how happy you will be. And if you have a hemorrhoid, you know how painful they can be. And so it's an ideal way that you can use it. Just simple, but you can have it as a frozen one. Frozen first. Tumours, you can rub on a tumour. And especially they say that it's very good for fibrocystic breast lumps. I'm going to show you how to do a poultice in a minute, and you can do it as I said, for a fibrocystic breast lump. But I actually want to share some, and I'll just divert for a minute, because in my book, and you don't need to look at it now, but there is a section on chocolate, the harmful things chocolate has got into it. And you know what? One of the things that chocolate does, people who eat chocolate will, one of the symptoms, or the symptoms, one of the side effects of eating chocolate is fibrocystic breast lumps. Now, who's telling all these women who've got this little hoard of chocolate in their cupboard at home and they've got fibrocystic breast lumps that they are related? Who's telling them that? And guess what? I never forget, one of my class I did, there was a woman that's just sitting in the front and she says, it was like the penny dropped. She says, I like chocolate. I love chocolate and I've got fibrocystic breast lumps. And she said, well, I said, cut your chocolate out. I used to love chocolate. I guess I was a chocoholic, But I haven't had it for years and years now. And you can live quite easily without chocolate, I can tell you that. It's not hard. You manage to stay alive, you don't drop dead. And it's not hard once you get rid of it. And I bet there's some of you here who've got little hoards of chocolate in the cupboard at home. I just know it. It always happens. And you've probably got some hidden from the kids too. I know that's the way it goes with mothers. And so just remember that these are the things that they're related. And you'll find the information and how this was all written in by Agatha Schrash in her book about chocolate. And I just got all the information. Agatha Schrash is an American doctor who has since died, but she had a book out on it, and she says the harmful effects of chocolate. And she said chocolate versus carob. Carob is so much better for you. So if you want to eat, if you've got that taste and think you can't exist without chocolate, well, just swap to carob.
Compare normal chocolate to dark chocolate, real chocolate. Even the dark chocolate would that cause...
Yeah, eventually people will say that, but I'm going to just say chocolate. I'm going to say chocolate. There's no excuses. You know what? My philosophy in life, we need to get rid of this sweet tooth which we feed all the time, because, that is breaking down our health. Do you know what? It doesn't matter how many. I can still remember years and years ago, and people who my age will remember it, there used to be an ad on television with Professor Julius Sumner Miller, who's saying how much sugar and how many glasses of milk is in a glass of Cadbury's chocolate. Guy, remember that? How much sugar is in chocolate? So much sugar, because it's very bitter. And so we need to realise that's where a lot of our health problems are coming from. We're having things and we excuse them because we really want to have them. I'm sorry, I'm not taking...
I just wanted to know, cacao, so where do you class that?
Cacao, well, where do I class cacao? I actually still have a bit of problem with cacao because it's still from the chocolate, but it's less offensive, right? It's less harmful. I don't use cacao, I use carob. Yep. Okay, getting back to our castor oil, where are we up to? Poultices. Let's go back. Kidney stones, gallstones, liver congestion. Hands up who has a congested liver. Everyone would say, I know I need to get my liver cleansed out. Well, this is the way you do it. You use a castor oil poultice. It's the number one poultice for liver congestion. But you can do it on wherever. Let's say you're doing poultice, you can do it on your liver area. If you had a stomach, you can do it on your stomach area. Another one that they're having one of my friends, she runs a health retreat, and she says a lot of the girls are having fibrocystic lumps they're having in their uterine fibroids. And this is a way for you young girls to use, and I'll show you how to use, make a castor oil poultice now, but a lot of the girls are using those panty liners as a poultice. They drizzle the castor oil over a panty liner and they put it over their pubic bone, and they put their pants on over the top of them, and that keeps it in place. And a lot of the girls, it's helping those girls who have those fibroids over that area. If you want a larger poultice, you do a larger poultice. But they're doing that every day, and it seems to just every day is a little bit every day is just getting rid of those, and that castor oil can penetrate into your body. That's the point. Sciatica. Now this is when you do it. If you had sciatica, you would do the castor oil poultice right down that whole area where the sciatica is. Now I would personally prefer to do a water treatment, which you will just take the pain of sciatica away like that. But if you don't have the water treatments, you can use castor oil for it. Eyes. Now this is excellent for your eyes. What I do is you put a little bit of castor oil in your hand, a drop or so, and then I'll just tell you this, one of my friends, she was a nurse, and she said years ago when they were in training, this is what they did every night to their patients. They'd go around and put a drop of castor oil in their eyes, and you just put it in your eye like that. I just wipe it across my eyes. I've been to a class, I've had a class, in my class, in the same class, there was two people, they had these, I don't want that on my eye right now. They had two people, they had blocked tear ducts. One of them, they felt gravelly in their eyes, and they put it on. At the end of the class, they said, I can't believe it, my eyes feel great. And it does, it unblocks the tear ducts. It can sting momentarily. It normally doesn't, but it can. But don't let that worry you. It's not bad to have your eyes sting, because what it's doing, that stinging, is actually bringing out more gunk out of your eyes. Okay, let's get back to it. We're on to lumps and sunspots. So the same thing. Now what I'm going to show with you, what I've done here, I've got what we call blueies. Have you ever heard of blueies? Blueies are like a padded, they've got a few thin layers of padding, and they are plastic backed, and you can get it from, I got these from Medical Rehabilitation Supply. Where do you get your blueies from? Maybe some chemists have them. But you don't have to use a bluey. Why I like these is because they've got the plastic back and they've got the padding in the front. They are ideal for castor oil. That young man I told you about with testicular cancer, every night he would do a castor oil poultice over his scrotum area, and they would do the potato poultice in the day, and they would do the castor oil at night. And then you just use his jocks to underwear to hold the poultice in place. And as I said, he was cured of his testicular cancer. And you know what? He was 30 years old, and his wife had only had a baby about 2 weeks prior, and then he gets notification that he had to go and have his testicles removed. Really sad, hard decision to make, isn't it? Now, this particular one, I've just done a bluey and I've made a pocket there. I've run some masking tape down the side, and so what I've done here, I've just got an old hand towel which I've got doubled, and I could soak that up. Actually, that's not going to fit in here, that fits in this larger one. And I would just soak this with oil and put it in here, and then I would put that on over my liver area. Okay? Or there's another way which a lot of people are doing, and this is just as easy. I tend to use the cloth more so than the paper towel, because the paper towel is, you'd have to throw it away after this. With a cloth, the very few poultices you can reuse is the castor oil. You don't have to throw it away, because what it does, it disperses any of your toxins via your bloodstream. It doesn't pull it out into the poultice. So you can reuse it. But now if I was going to put it on one night, then the next night I'm look at it, I would add a bit more oil to it. Then the next night I would add a little bit more oil to it. And what I would do, you can put it on like this, and then you can put on a bit of plastic. Now Glad wrap doesn't do it because it just goes everywhere. Okay, so what I would just do is a piece of plastic, just a bit of thick plastic bag, which I've cut up, put it across there, and then I would bandage that in place. I've even been known to wrap it around with Glad wrap right around their body, depending how you can put it into place. Or you put tight clothes on to keep it in place. You need to keep it over the liver area. This one you can leave on overnight. You could put it in if you wanted to have it, you could put it in your bra if you've got a lump in your in your breast. I would just add a little bit of plastic over it and just put it in your bra and tuck it in there. And you could wear that around all day for breast lumps. Wouldn't hurt you. The idea with it, they say for liver, 3 nights on, 3 nights off. If you are in a critical situation, I think you need to have it more often than not, but you need to allow your body to break down that gunk, that toxins, and allow it to go out through your body. That's the only thing you need to do. So you don't have it 24/7, you'd have it maybe of a night. Or some people don't mind wearing it at night, yet you've got other people who don't want to be restricted at night and they don't mind wearing it during the day. So you could have either or, whichever one suits your lifestyle and how you would like it. Now let's get back to this one here. This is the castor oil. Now I'm just going to put it on some paper towel and I'm just going to drizzle it over the paper towel to make it sort of saturated but not too wet. And just get it some it's probably a little bit much there. Allow it to soak in a little bit. Now I would put that, I'm not going to put it over my clothes because I'll mess my clothes up, but then I will put that on. So that is how you do a castor oil poultice. With this particular one, with this cloth, as I said, you would put it on there and you would put it in the middle part for your liver. Now, realise that this is not something just a once-off. If you're going to really be serious about cleansing your liver, you're going to be doing this quite often. So you need to get yourself set up and just maybe make a poultice. As I said, this is just an old hand towel which I've just stitched to make it. This is double thickness and it's reasonably worn, so it's not a thick hand towel. And so it's going to be a rag. It's just going to be used, and you just put it over your liver area. But you can put it anywhere, wherever you want it. You might want it on your hip. You might want it on your shoulder. You could put it anywhere.
So the castor oil draws it out?
Yes. No, the castor oil, it disperses it via your bloodstream.
Okay.
Yeah. Yeah. Now, castor oil, I'll just check if I've got any more. Yeah, that's castor oil. Now I'm going to go on to cayenne pepper. Cayenne pepper is a systemic stimulant, not a neurological or nervous system stimulant. It stimulates your circulation. Very good. It's not like black pepper. Black pepper can actually irritate your body, irritate your stomach. This does not irritate. It does not irritate the stomach or the digestive system. Okay, now I'm going to share with two ways we're using cayenne here. First of all, we're going to use it internally. And when you take it internally, now I'm talking about taking it through your mouth and drinking it. How do you take it internally? Well, you put it in some water and you drink it. Or whatever, you put it in whatever liquid you want to get it into your body. It increases your circulation. Now, you know, if you've taken cayenne and you drink it, you know what it does to you. What does it do to you?
Warms you up.
Warms you up. It really warms your whole body up. But the one I want to tell you about, and everyone needs to know this, is that you can stop somebody who's going into a heart attack or a stroke. How do you do that? Well, I can still remember one of the class. This has happened at one of my classes. I was telling them about taking it internally, and I said, what you do is you get cayenne, and you put you either two ways. You can either just put it in the mouth. If they're out of it, you just sort of. Sometimes you can just go and put a spoonful of cayenne pepper and give them a bit of water, or mix it in water, whichever is quicker. There's no rule. Okay? You just get it into them, because what it does, it dilates all their blood vessels in there, and it just brings the blood to the area, and they'll come out of a heart attack. Now, I was telling them about, and I'll show you how to do it in a minute. I was telling my class about that, and a lady, and I was telling them about a friend of mine. She at this health retreat down, it's closed now, but it was down near Melbourne at that stage. She was in a class, and in the class, this woman, she just fainted. She just went out to it. And her husband says, oh, quick, she's having a heart attack. She's had a few of them. And so Barbara went over and she just got some cayenne pepper, threw it in her mouth, and gave her a bit of water to drink. And immediately, within seconds, she came out of it. And I've heard this often. I've heard different people doing this as often. And I was telling my class about that, and a lady said, excuse me, she says, I was the lady. Yeah, she was an elderly lady, and she came in the class with some friends of hers who happened to live up here. She was living in, I think, in Melbourne. She came up and and what it does, it really brings blood to the area. So just remember that. Everyone needs to have cayenne pepper on hand. Now, I have got some cayenne pepper here, which is on the table down there. You'll find some down there, which I bought a little bit in. If you want some, get yourself some. This particular one is about 60,000 heat units. Cayenne pepper that you buy from the supermarket is probably about 3,000. So it's nowhere near as effective. You need to get yourself good cayenne pepper. But increases the power of all other agents. It stimulates organ secretion. It stops internal bleeding. Now, I've had this too. One lady, she came around, she says, my elderly mother, he's having a bleed from the bowel about twice a year. And she says, what do I do? And I said, well, have cayenne pepper. And she said, well, she goes to the doctors put her in hospital. She's in hospital for 10 days, and she comes out and they said, well, we don't know what it was. And she said, this has happened quite often. And this lady herself was an intensive care nurse. She knew how to treat her mother. And she said, and I said, well, get cayenne into her. So she came around to my place, it was late at night, and she gave her 2 drinks of cayenne before she went to bed. in the morning, because normally it's best to do it every hour, on the hour, if you're trying to bring someone out from a bleed. But she didn't, because she didn't want to keep her awake. She was elderly at this stage. She was probably 90-ish, you know. Anyhow, in the morning when she woke up, she said to her daughter, she says, I think I'd better go to the hospital. And they put her in, but she said, would you believe she was only in a day and a half because it stopped. Her bleeds stopped. She said, I'm convinced. I'm totally convinced it was that. Now, another one too, which I know, and I've met this lady, and I've told some of you have heard this story, but she was having bleeding. She was going through a menopause, and she was having incredibly heavy bleeding. Now, some women who've gone through menopause know that, and know that nothing you can do stops it. She didn't want a hysterectomy. So she went to a naturopath, and the naturopath told her to take 3 teaspoons of cayenne pepper every hour on the hour for 3 days. She did. And guess what? She was cured. How do you get 3 teaspoons of cayenne pepper in your body every hour on the hour? She said it's easier if you drink it in soya milk. Doesn't burn as much, but there is a trick when you take cayenne pepper. At the front of on your tongue, at the front, is where you really taste the cayenne pepper. If you drink it and try to get it at the back, and then you drink it down, it is less burning, but it still burns. Okay, but it's less. There is also another way too, which I've got here, is some straws. Another way you get it in, that bypasses that front part of your tongue and it gets it in at the back. You could also take it via capsules. You know, you can fill up your capsules, which is fine. They say it is actually better if you take it in your mouth, because what happens, it signals your brain, it signals everything that cayenne is there, and it will bring things there. It will know that something's happening here. But if you allow it and you just drink it down and it happens in your stomach, you don't get the same effect. So can you see it is more important to have to drink it, but I accept it. Not everybody can drink it. Now, if you've never tried it before, just take 1/4 teaspoon in a glass of water at first. Well, I've got a little bit down there. I've got some packets down there. You can buy it. It's not that expensive. It's $8 a packet. So my husband's down the back. But you can get any cayenne from anywhere. The reason I sell it is because I know that I want something that's a little bit more powerful than the supermarket one. And this works fine for us. Oh, that's another thing. I'll talk to you about it in a minute. But when I was, let me just get to it in a minute. Peristaltics, colds. For one of the classes, one woman was cough, 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 and so somebody went and just gave her a glass of water, and she stopped coughing. Sinus problem. You stop everything else too. You know, you get this. You get Cayenne down, you really know it, don't you? Okay, now I'm going to talk to you. Actually, I'll come back in a minute, but I'll talk to you about externally first. Cayenne pepper is a heating poultice. You put it on your body, it will heat up the area. Now, ideally, you want it if you're going to put it around your throat for a sore throat. It will heat up. I've got other things that I can do for sore throat. To me, it's not the number one for sore throats, but it's good. You can use it. It's ideal for arthritis. And a lot of people, and the same woman who was the intensive care nurse, whose elderly mother I told you about, swore by Cayenne. She wore Cayenne poultice over the back of her lower back because she had been so affected by lifting patients, in her nursing career. Her back was so bad. She said it was the only thing that kept her free, because she said it really warmed up the area and it felt her really good on the area. You can stop bleeding. Now, many times I've cut myself, when I'm slicing. What you do is now this is cayenne pepper. It might look like it's not, but it is. And you just shake it on the area. So if you're bleeding, shake it on the area. Then if it was a bad bleed, I will get, like a cloth over the top, put it there, and then I would add a little bit more and hold it there.
Does it sting?
A little bit, not much. Not that much. Okay? Not that much. It does, but then it brings blood to the area and it heals quicker. So you'll find it will heal quicker. Okay, so you've got cramped muscles, pains and old injuries. And one of the classes I was with, there was a lady there. She'd broken her ankle 1 year before and she was still stiff in the ankles. And I said to her, or the whole class, there was one lady, she did the Cayenne poultice and she'd just broken her ankle and was out of plaster. And the other one was a year later. And the one that was a year later said that it felt so good, it was the best that she wore it the whole week we were there. She just loved it. She said, here it is. There it is. Okay, Cayenne. Somebody asked me, fresh out of your garden? Yes. I spent time, I did a trip went over to Tonga and shared with the people. I did classes all through Tonga. One fellow was at the class and he'd actually dived into the ocean and he hit his head and he hurt his neck. And he came back, he says, I've been like this for a few months. I can't turn my head. So he could only turn his head like that. And so I got him up out of the audience and I put the poultice on around the neck. And he said it felt so good. In the morning, he came back to the place where I was staying and he still had the poultice on his neck. And I said to his daughter, "What's he still got the poultice on his neck? Didn't he take it off?" Oh, he had his shower, but then he put it back on because it felt so good. Okay, so when we were in Tonga, the ladies, I went with a group of women from Fiji. I think there was about 5, 6 women from Fiji, and I was the only Australian, and I would do the talk, and they would mix with the people, and they would teach the people how to cook. They would teach the people how to do the things because, the Fijians and the Tongans are similar in their diets. What do they... Because there's no point me saying to you what I would cook for them I don't have what they have over there. Anyhow, the one man, they took one little packet of cayenne pepper with them. And do you know something? We could not find cayenne in any shops over there. Now, since then, one of the ladies, she's brought it in now. People can go and get the cayenne from her. But at that stage, you didn't have any cayenne. And so... we had to be sparing with this cayenne when we went around treating people. But when I came home, I sort of thought to myself, now, what about cayenne out of our garden? And we had one of the hot cayennes in our garden, which somehow or other got mixed up in a punnet of, the normal ones. We had, we had one plant that I'd bought as sweet capsicums, but it was hot as. And so I used that and I put it on the skin, and would you believe, I thought, yes, it does exactly the same. Okay, so if you don't have the cayenne, use your hot cayenne. But I can remember in Tonga, we were staying at the place, and the lady where we stayed, her son played rugby for Tonga, and he had this injury. And I put the cayenne around his ankle, and I said, now, if it gets too hot, take it off. There's no disgrace in taking it off. But you know what? It did not last at all long on the man. It got so hot on him. Can I tell you, it gets very hot on people who are very acidic in their body. If you've got a lot of uric acid in your body, it reacts on it. So you'll find that little old lady, she can handle that Cayenne heat twice, 3 times more than a man. A lot of men are a lot more sensitive than the woman. So you have to understand that. Okay, so we're getting back to making the Cayenne poultice. Now what I do here, there's 2 ways I make it. Now I'm just going to use the oil one that I used for the castor oil. Now if you didn't have castor oil, you could even use olive oil or something. Now, the reason I'm using oil, because if you put water on there, it's going to dry out and it's just going to flake everywhere. But this one's going to stay oily. So what I just do is this came out as a blob. Yeah. I'm just going to shake it there. Can you see what I'm doing? Now, how much do you think you will have? I have no idea. For some people, that will be too much. For other people, that will be no, it won't do anything for them. And they can put that on, and you can put it on wherever in your body. You can put it on your knee, you can put it on the soles of your feet, you can put it on your shoulder, and you can go to bed with it. You can tape it on with a Glad wrap around there. And you know what? You'll come back next day, and it still hasn't heated up. Because I have no idea how much you would take for your body. You've got to work out how much you would put on yourself, right? But it will activate more if you heat it up. Okay, so I can remember once I just put, and they say this, if you want to warm your feet up, just sprinkle a bit of cayenne pepper in your socks. In the middle of winter, you've got cold feet, just put a bit of cayenne pepper in your socks. Well, they'll warm your feet up, especially if you put your feet in front of the heater. They won't get cold. They will stay hot. They will just stay, because it brings blood to the area. And you see, blood brings healing. That's the secret of this. It's your blood that's going to do the healing. You're going to bring it, and you're going to have it. So, that's one way I do the Cayenne poultice. But another way I do it, I just use flour. Some people have used flour. Now, I just put a little bit of flour and a little bit of cayenne pepper. How much cayenne pepper? I don't know. 1/4 teaspoon, 1/2 teaspoon, 1 teaspoon, I don't know. Now, I can still remember I was in one class in Fiji. I was privileged. I called it a real privilege. I would go to Fiji. I went for 8 years. And I went to this school that they were teaching medical missionaries. They're teaching people to go out into the community with all this sort of stuff. And there was a 6-month course. 3 months was practical, 3 months was theory. So I would go over and do 1 week of the block of theory. And so they would always leave me to do the same thing. And every year I'd go and do the same program. And I just got to know them, and they're like very good friends of mine. And I can still remember I did this, and then I added this one. I had this on one guy's knee. On his other knee, I did it this way. So I've mixed flour and cayenne. I mix a little bit of water to make a paste. Oh, I might have put too much in there. I'll just see. If you put too much, you just have to add more water. More flour. Yes, true. And just a smidgen more flour. What do I do with it? Well, I don't do what I did once. I was up in Cairns. I was doing it on somebody up in there. And I didn't have any flour with me. I had tapioca flour. And I don't know about you, but tapioca flour sets like plaster of Paris. And I did this on his back. And you learn the hard way, don't you? But he says, oh, that's a bit hard. It was like a lump when I finished it. So you just got to use, I don't use normal flour, and I don't have normal flour, white flour in the house. But so I've got a little bit of buckwheat flour here, but that's the sort of consistency? Yeah. Now, I don't know if anybody wants to try these on here. Somebody wanted to try it on this Cayenne one, on their arm. We'll use the arm because it's easier. Got 2 volunteers? Okay, come on, girls. Yes, we'll put this one on you. Actually, I think you'll need a little bit more than that.
I've got a little leg. Can I put it on there?
Yep. Yeah. Okay, so if we can just come back here. There. I don't know if the camera can see, but anyhow, we will take it. If you're using Glad Wrap, you've just got to learn to twist it. Sometimes you can actually go over the other way around. That should be fine there. Okay, so have you got a place where you want it put? On your arm? I'll just put it on the paper towel. It's easier if then the people can see it. And see if this one gets... Now, you can put this in the chucks, but I generally put this one straight on the skin. Okay, just on your arm here. Can you stand up in front so they can see it? And then you can tell everyone at the end if it's getting hotter. But as I said, different people, different amount of cayenne pepper. But you need to have cayenne in your house. Ideal.
I cook with it all the time.
Yes? Okay. Now, we're going to have a few more shorter ones, and that is honey. You'd know about honey poultices. Oh, you can make cayenne oil. You just mix cayenne pepper and some olive oil. You leave for 2 weeks and you strain it, and that becomes your cayenne pepper oil. And you can apply this to cramped muscles and arthritic joints. Now, honey, you can use it internally. You know that you can use it anywhere internally. Sore throat, stomach ulcers, hiatus hernia, insomnia. But you use it externally on ulcers, itches, sores, wounds, stings, insect bites and acne. You can use honey, you can mix a tablespoon of honey in tepid water and you can drink it between meals, or you can apply honey directly onto the affected area, leave it till it is dry for 20-30 minutes, then wash and replace with new honey. So you can use one. I had one lady, she told me she was just itchy all over. I don't know why she was itchy, but would you believe it? She was an apiarist. So she had lots of honey in. So she said she went and her husband coated her in honey and she wrapped a shower curtain around her, and she said it just took away the itch out of the honey incredibly. And that same class I had, there was another lady, and she says, my little girl had an asthma attack. And she was an asthmatic, and she said, what will I do for her? She said, my husband actually works in intensive care at that local hospital, and she said, he knew what they were going to give the child. And she didn't want that, and he didn't want that for the child. The child was about 3 or 4. And so she prayed, she went and she prayed, and she said, Lord, please, what will I give this child? And the idea came to her, honey. So she got a plate, a dinner plate, and she smeared I'll just use that like a dinner plate. She smeared honey all over the plate, and she put the honey up to the child, and the child breathed in and just took the asthma attack away. And she said she minded some little child. And she said he did the same, and she did the same for him, and it took it away. Now, that's only two anecdotal things that I've heard, but it's just something that you can store in your mind. Because we actually, and I don't have any, I'll bring it into next week, I have some turmeric too, which we had a class once, and in the class we had a meal. We had a nice meal there. We were teaching them how to cook. I can't remember exactly what we were doing, but we had a meal there. And a woman brought her little boy. He was about 8, and he had some pumpkin soup. Now, in the pumpkin soup, we blended some cashews, which makes it very creamy, like a cream. And the boy had it, and we didn't know he's allergic to cashews. And his mother forgot his EpiPen. Immediately, the lady who was doing the herbs, she's a friend of mine, she immediately went over and got some cayenne pepper out of a bag, put it in, turmeric, out of a bag, put the turmeric powder in water, added some water and gave it to the little boy to drink. Within about 2 or 3 seconds, he came out of his anaphylactic shock. Turmeric powder. I would assume you can use the same with cayenne. It's something to store in your mind. You need to know these things. I believe we're going to be in a situation. God has given us all these things, and I want to remind you that when I do these, I'm always praying and I'm saying, Lord, please heal these people. These people need healing, and they need to know. We need to know these things, because God's going to put us in a situation with many what we know, what we're learning, is going to be used and going to be vital for some people to use. Now, I didn't get anybody to taste the cayenne pepper yet, did I? Does anybody want to be a guinea pig? Well, I don't know if that's too much. I don't know if she'll get it all down. I won't give you too much.
No.
Is that, see?
Yeah, that's what we find.
Now, the secret is to get it back in the back of your throat. It's like scull it down. You don't have to drink it all.
It's not too bad. Yeah, it's all right.
Yeah.
Kaye,
Yes?
honey is the antidote to a bee sting.
Yes.
Great.
We have bees, and my husband was swimming around in the trees and all, with the snipper, and he came running. I heard this yell. He came up, he had about a swarm behind him, and he dropped the snipper and ran up to the house. And he ran inside, and he had bee stings on his arms and his face, and I just grabbed the honey and smeared it all over him instantly.
Yeah.
No.
So there you are.
No,
Honey is the antidote for bee stings. Okay, there's another thing you can actually mix, honey in equal proportions with sugar. If you've got an ulcerated sore, you want to actually debride, when you've got that sore that you can't heal. Honey and sugar, make equal parts of honey and white sugar and apply over your sores. This cleans, disinfects, and it will stop when it gets healthy skin. Okay, now here's another couple of ones which I want to finish on there. I've got a few more little bits and pieces, but not main poultices. For eye problems, everybody wants to know, how do I get rid of dry eye disease, age-related macular degeneration and cataracts? Okay, cataracts are caused where our eyes have been designed to break down that film. Why isn't it breaking down? Why are the cataracts forming? It's because our eyes are not we're not getting our own, our own tears, or what you can say, the tears are not clearing the eyeball. Okay, now this is not going to cure the cataract. This is going to open up that tear duct. In the night time, mix a 1/4 teaspoon of raw honey with a 1/4 teaspoon of filtered water. Place 2 drops of the solution into each eye. This will smart the eye. Yes, this is in your book. You'll find it. I can't remember where. Okay, in the morning, 1 drop of lemon juice in each eye. This stimulates the tear duct to dissolve the plaque. This will smart the eye. Now, this will make your eye sting, probably for 5 minutes. Okay, that's normal. Remember that, okay? So it will, but that will dissolve that cataract or the plaque. Now, this is for glaucoma, dry eyes, lazy tear duct. And this one's not in your book, so if you want to jot this one down, this is something that I've only just found, like you can add it to it. But you, 1/2 teaspoon of vegetable glycerin, 1/2 teaspoon of table salt, 120 mils of water, and you mix, then place 2 drops twice daily. This unblocks the tear duct, fluid moistens the eyes and lowers the pressure. This will sting a little. Remember? Do you know something? I've even used Cayenne drops in my eyes. And you know what they say? That is one of the best healing things you can do for your eyes. You're bringing blood to the area. What we want is blood brings healing, and it stops all the congestion.
Could you go back to the other one, the one before that? Yes, thank you.
You're right. There's still a few more I want to talk to you. Now, I've got some. Years ago when I first started this is my old book called Back to Eden by Jethro Kloss. And it has got some fantastic things in there. You will not believe what you can do and use. And when you read this, you think, oh, I didn't know that was edible. Most of your plants and that are edible. Now, you can use practically anything on the outside of your skin if it is edible. It's obvious you're not going to use poisonous things on the outside of your body, but anything. And so I've got an interest with all these things, and I've just developed all these. I've heard of them over the years, but I've just incorporated them into my lifestyle, and they work. By the way, too, getting back to that Cayenne poultice, my son had a hamstring injury, and how does he get, you got a hamstring injury, you live alone, how do you get the Cayenne poultice on? Well, he worked it out. You lie on it. You put it on the bed, and then you lie on it, and you bring it up around there. And he said he took half as long to cure his hamstring as normal. Because it brings blood to the area, it will heal it. Now, if you've got a lower back, you live alone, how do I get things on my lower back? Well, you lay them out on your bed and you lie on them and you bring them up around yourself. So you've got to learn to do things yourself sometimes. And this can help so many things. Okay. I want to talk to you also about magnesium. Now, I've got an article up there on, I'm not sure if it's there, I think it's there, but it's on my website, on magnesium. Almost everybody is deficient in magnesium. Heart palpitations. How many people get heart palpitations? So many do, and they think, oh, I've got to run to the doctor. I've had a heart palpitation. You know what I realised? I'm a bit short on magnesium, so I just go and take a dose of magnesium. You can also have, if you have cramps, you can actually buy super magnesium cream. Now, you can actually buy magnesium chloride flakes, which I have, and I make the oil. But sometimes in the middle of the night, if you've got a cramp, you don't want to be making oil. So there's cream, magnesium cream. It's excellent to go out, and you can buy that ready, and you can have it on your bedside table ready to just to pop on a cramp or something at night. Now, there's another thing too, which you can also do and know about the miracle of MSM. Now, MSM is methyl sulfur methane. I'll just get it right. It's a hard thing to say. Methyl sulfonol methane. And it's called MSM. And it's really sulfur for short. Most people are short in your sulfur. It's good for degenerative arthritis, chronic back pain, chronic headache, muscle pain, fibromyalgia, tendinitis and bursitis, carpal tunnel syndrome, post-traumatic pain and inflammation and allergies. And who's not short of sulfur in their diet? So many of us are short of sulfur. Now, I want to tell you something. I had this, and I came across this, and I started taking it, and you know what? I took it, and I had problems some years ago. My hair was starting to fall out. You know what happens when you get our age? All of a sudden, no, I'm losing too much hair. I just took some sulfur, just like that. Sulfur is excellent for...
What is that, in a capsule form or?
It's powder.
You can get it in capsule.
Yeah, you can.
The powder is foul.
Yeah, it doesn't taste that good. But look, my philosophy is be brave. Be brave. Don't be a chicken. Okay, but you can get this MSM from a chemist warehouse. It's quite readily available anywhere. And, you know, it's excellent. You need to have it because it's something. And I've got an article on it in my newsletter with the vaccination, the second last one. It's in that same newsletter, and there's an article on it, the valuable that you can use it for your newsletter, for anything, and it's in the newsletter. Now, the other thing I was going to share with you, who have your skin brushes?
I've got a thing that I do in the bar.
You know, this is ideal, especially as you get older like me. Your skin starts to get dry and flaky and whatever. But you know something? I do this I love it. Oh, it feels so good. And then you do it everywhere. Over your body, over your back, over your stomach area and your legs. It really helps it. Now, I've got a softer brush that I do over my skin, around my neck and my neck, but you brush it towards your heart. And you just do it like that. And it feels great. Makes you feel skin. And not only that, it brings blood to the area. So what's blood to the area doing? Healing. And so many people, they're just so stagnant. Their bodies are just not, what can I say? Their blood's not moving. You take your cayenne pepper, what's going to happen to your blood? It's going to start moving. It really will. It heats your whole body up. Yeah. Okay, so now, before we finish, is there any questions? Just...
No, cupping is a different thing.
Yeah, it's not cupping, it's just brushing, it's skin brushing. This one here, I like the thicker one. This is a Bernard Jensen brush. It's a little bit stronger. It's not, the soft brush is, to me, is too soft on my skin. I like something a little bit stronger. And so that's a Bernard Jensen brush. But I've got the softer brush for the softer parts of my body because I don't want, that's a bit, it does scratch a bit. Yes? Okay. Lourdes, can you come and take the microphone, please?
Hello? Hello? Hello. When you heat things, you don't use a microwave at all, do you?
No.
No, just checking that. And just one other thing. When I was working in aged care, I was left with an old gentleman who'd cut himself while he was shaving, and he was on warfarin, and he was bleeding, and I was there for 10 minutes and it still wasn't stopping bleeding. So I said to one of the girls, I said, just go and bring me the pepper. And they looked at me like I was off my bicky tin. And I said, no, just go and get me a pepper shaker. Put it on, stop bleeding immediately.
Yeah. Cayenne pepper?
Just ordinary pepper.
Okay. Any more questions?
For the potato poultice, can you use green potatoes?
No, I wouldn't. I would use just normal potatoes. Yeah, no, green potatoes are not good for you.
I'm just wondering.
Yes?
I'm just wondering, when does this get put on the net?
I didn't hear that.
When will the slides be put on the net and your presentation?
On the internet, I think it's on there now. When will it go on the net? It's there now. Okay. And the address is, this one's Facebook, and it's Back to Eden with Kaye. Just hold on. Look, I just wait for the microphone because this is so that Cayenne pepper.
Yeah.
Sorry, say that again through the microphone.
What does it do to you when you drink it?
Same. Remember, I had the list there. It will increase your circulation. That's really blood. And what it is just bringing blood to your whole body. Is just circulating. Now, look, the secret is you're having it very, very mild. I didn't put much in. You'll build up, you'll increase it more and more. A lot of people, they have cayenne pepper. Cayenne pepper works hand in hand with hawthorn berry for heart problems. Cayenne pepper and hawthorn berry will feed your heart. You can work it together sometimes, but you don't have to have them both, but you can, yeah. Yes?
When you're making the onion poultice and you're dry baking it, how long do you bake it for and at what temperature?
I would bake it probably about 170 for maybe 20 minutes. It doesn't need to be overcooked. It just needs to be really warm through, and it doesn't need to be scorching hot. A little bit under your moderate oven. Any other questions? Here's someone down the front.
Hi. I was just going to ask if you had anything for mosquito bites.
Yes, I do, and you'll come next week and I'll tell you.
I'm just wondering if you have a recommended remedy for cystitis, UTIs, so that I don't have to get antibiotics every time.
Look, there's a few things that I would do. One thing would be a water treatment, which is called a sitz bath, which I'm going to talk to you about on the third week. But quite frankly, some people they don't know what to do. They won't have everything ready for a sitz bath. But the one thing that I have found really works well is corn silk tea. Okay, now when you buy them, we're coming into the season for corn, cobs of corn. Save your silks. The silk, okay, pull back the leaves. Just pull back all the silks off them. Lie the silks out on a place where you can just dry them off. They'll probably take 1 to 2 weeks to dry off. Then you can bunch them all up and you can save them and put them in a glass jar. Then I usually have about one whole corn cob silk, just the silk, and I'll put it in a cup and I'll pour boiling water on and I'll drink it like as a tea. And it tastes quite palatable. It's not terrible. Okay, and that to me, I can remember I went to one class, actually I was working, it wasn't at a class, it was a working, and one of the women came up to me and says, what do I do for my mother? She's like 80 years old. And I thought immediately, I'd been learning about uterine, anything with pelvic problems with a sitz bath. And I thought, you're not going to get an 80-year-old woman in a sitz bath. It's just not practical. You just don't do it. So I just said, I thought, Cayenne, corn silk tea. And so I gave her told her corn silk tea. She went out and she got it. And would you believe she came to me that was the week before the holidays. After the holidays, she came back and she said, guess what? She says, just worked like that. They said cranberry juices, but I found more success with the corn silk tea than anything. And generally, once you have that cystitis too, you'll need to keep drinking it for a little bit further on because it can come back. So and especially the moment you feel it coming on. So you need to have it. So get yourself a supply. And this is my philosophy. My home, I've got comfrey, and we'll talk about comfrey next week, but I've got comfrey ready because, there's always somebody who doesn't have it. And so you can say, well, look, here's a little bit, and that's my philosophy. And so I share it with people. But you see, if you think ahead now, I've got to dry up some corn silk. Well, you can buy corn silk tea for some people who don't want to have the ability to make it. But we're right in the time when you'll find that corns are coming in season here, and so you'll find it. So just grab yourself some, as many as you can, and just dry yourself off the corn silk. Any other question?
So I just wanted, that thing that you said was MSM. What's the full name of that?
It'll come methyl sulfonyl methane. Methyl sulfonyl methane. Yeah, but it does. It'll come up as MSM on in your search engine. If you look at Chemist Warehouse for MSM, you'll find it's there under MSM. But most people know it as a sulfur. Actually, I'll just tell you something else before I finish. This is my last one, is borax. Now, you read on here and you say, keep out of reach of children, okay, and all this sort of thing, and dangerous is swallowed or whatever. But you know something? I've been using this for years. I've got an article on this in my newsletter. Borax, you would have about a pinch of borax in a litre of water, or maybe let's say a quarter of a teaspoon in a litre of water, and you drink that during the day. Now that will strengthen your bones. It will do lots of things. Actually, I can't remember all the things. I've forgotten to read it up on. But it's very good for our health. But it's an arthritis remedy. Porous bones. I'm just thinking, what else do I use it for? Teeth, strengthening your teeth, all that sort of thing. Borax.
It's biotin, isn't it?
Yes. Okay, now the other thing which you can use, now this is excellent for any of girls who have vaginal thrush. You can use this, there's a couple of ways you could do it. You could put it in a capsule and insert it, and that will just clear vaginal thrush up like that. Or you can use it as a douche, which is probably easier, a bit messier, but it's easier. But the other one too. Now this will get rid of vaginal thrush just like that. And for so many young girls, they have just, what do I do? What do I do? And you think, and it's a pain in your life. This is excellent.
Would that take out candida in the body?
Oh yeah, that's right. It's good for candida in your body too. Look, it's good for so many things. I've got an article on borax, and it was the arthritis cure. I think that's what it was entitled. So it's really, really good for, because, it's a mineral in our body, and our bodies are deficient of these minerals. So we need these.
You can't poison yourself on it or anything like
No. Look, can I tell you, if you took too much, it'll taste quite soapy. Okay, but look, just cut back a bit. But a lot of people, they just put a pinch in their water. You don't need much. You're only having a little bit. Okay, any other final questions? Otherwise, we will call it an afternoon. Okay, so I'll leave it there. For the people on the online, I think we've gone these. This is the New Start. And by the way, too, and you'll read this in the book, New Start, these are the 8 laws of health. Once we follow these laws of health, and you remember the laws of health by spelling out New Start, by saying nutrition, exercise, water, sunshine, temperance, air, rest, and trust in God. So nutrition, whole food, plant-based. Exercise, well, everyone knows we should exercise. Drink plenty of water, get your sunshine, not overdoing it. Temperance means stop eating those things that are harmful to you. Your chocolates, I'm just picking on your chocolate because it's a soft spot with a lot of people. Air, rest, and trust in God. So you have a balance of all those, your health will return.
Can I ask you one question, please?
Yes.
Stevia in coffee that you take in place of sugar, is that really bad for you?
No, it's good for you. Stevia is fine as a substitute. Okay, so we'll leave it there. Thank you for coming, and we'll see you next week.